Thank you to Solving Kids Cancer for the opportunity to give an update on the REDMAPP study, which is the development of a decision aid for parents with a child with relapsed or refractory neuroblastoma. My name is Helen Pearson. I'm an advanced nurse practitioner for children and young people diagnosed with solid tumours at the Royal Marsden NHS Foundation Trust, and I'm a PhD student at the University of Southampton, based in the UK. This study is in collaboration with two academic supervisors, Professor Anne-Sophie Darlington, who is a professor in health psychology at the University of Southampton, and Professor Faith Gibson, who is a professor of child health and cancer care at the University of Surrey and chief nurse for research at Great Ormond Street Hospital. So in order to be able to develop a decision aid to hopefully support parents in the future, we first need to understand how parents make treatment-related decisions. But before we do that, we need to understand what we already know from the literature and research that's happened up until this time point. So we know that decision-making is a partnership approach between parents and healthcare professionals, and with the child where appropriate, and is one that requires quality information and consideration of individuals' values and preferences that they may use to inform their decision-making. Within children's cancer research, there has been decision-making for single events, for example, decisions to participate in clinical trials, and whether to continue with cancer-directed therapies. We know that decision aids can support complex decisions when there is certain and variable outcomes, such as, unfortunately, in the case of relapse and refractory neuroblastoma. So decision aids, we know they can have a positive effect on decision making through a systematic review, which looked at adult decision aids used within adult cancer care. They were shown to reduce decisional conflict, decisional regret, increase confidence in making decisions, and can facilitate conversations with healthcare professionals. Within children's cancer care, there is one decision aid called Delta. This has been developed by the team in Sydney, Australia, and that is for parents and adolescents who are considering participation in a clinical trial. Within children's care, generally, there are decision aids for single events, for example, medication choices in juvenile arthritis, and surgical options to support tonsillectomies. So what are decision aids? They have three key components. They provide information on treatment options. They provide information on values and preferences. This is usually in some sort of what's called a Likert scale, so rating between 1 to 5 or 1 to 10 on values and preferences which are considered to be important when making decisions. And people that are using that decision aid can then vary the Likert scale based on their individual preferences. And decision aids can facilitate conversations with healthcare professionals. What they don't do is advise which treatment option to choose, and they don't replace discussions with healthcare professionals. So in my clinical experience of working with parents of children with relapsed and refractory neuroblastoma, they won't have been involved in treatment decision-making previously because there's a frontline protocol which is established. But parents want to be involved in making treatment decisions, but they can feel that emotional burden of having to make repeated decisions depending on the child's response to treatment. And they can experience conflict and regret around the decisions which they make. So what do we know about high-risk neuroblastoma? We know 40 to 50% of children relapse, and at relapse there is no standard treatment protocol, but varying treatment options available. These treatment options are presented to parents, and parents subsequently make repeated treatment decisions based on their child's response to treatment. In July this year, we added in parents of children with refractory disease. We know that approximately 50% of children are term refractory if they don't meet the milestones after completing induction chemotherapy on the frontline protocol. There is one protocol-driven option for refractory disease, and that is Veritas, which has just opened in the United Kingdom over the past year. And further treatments are much similar to that of children with relapsed disease. This study has huge patient public involvement. The group was formed back in February 2018, just before the study got going. These are parents and carers of children who have experience of having relapse and refractory neuroblastoma. They have been involved in, well, they developed the REDMAPP acronym and the logo that is associated with that. They've co-designed with me the REDMAPP study to ensure that the information on the website is user-friendly for parents. They have reviewed all parent-facing information, so the information sheets and consent forms, to make sure they're user-friendly, accessible and understandable for parents, And they've also co-designed the research questions. We've had huge discussions around ethical considerations of being involved in such a study like this when parents are actually making treatment decisions in real time, and making sure that their parents can be approached at a time to try and minimise ethical burden of being involved in such a study, but trying to maximise recruitment. They've been involved in the study amendments. As I mentioned, we amended to include parents of children with refractory disease in July 2021. And last year, due to COVID, we also added in parents being able to self-refer to the study. To be able to understand this repeated treatment decision-making process for parents, the parent group also designed a decision-making flow diagram. As you can see here, there's two options. We updated this in this year following the introduction of refractory disease. But this is showing that parents are presented with various treatment options and they have a decision point and they decide which treatment option to choose. That treatment may be given alongside symptom management, depending if they're having any symptoms. And then the disease will be reassessed with scans. And depending on that, whether they've got stable disease, progressive disease, is whether or not they would need to make a subsequent treatment decision. And as you can see from the diagram, this can go round and round, and parents can make multiple treatment decisions, as I said, depending on their child's response to treatment, and also the toxicities, managing the side effects from the treatment given. So the REDMAPP aims to develop a decision aid which supports parents in their treatment decision-making when their child has relapsed or refractory neuroblastoma. And we're doing that in several ways. First of all, we're looking at the literature around values and preferences in treatment decision-making. And we're also doing parent interviews at the time that parents are making treatment decisions. And once the decision aid is developed, it will then be user tested with parents and healthcare professionals to ensure that it's accessible, it's acceptable, and it's user-friendly for parents ready for clinical practice. So the study design is split into two phases. So in phase one, we have the literature review and also the theory around how people make decisions in everyday life. And that data combined with the data from the parent interviews will be integrated and used to inform the development of the decision aid and subsequent user testing. So where are we at to? So if we're currently still in phase one, we are undertaking the literature review, and that has two questions. What are parent values and preferences when the child is receiving cancer-directed treatment for poor prognosis cancer? And how do these values and preferences inform treatment decision-making? In May this year, the literature review protocol was published. It is open access, which means anyone is able to read this. And we are currently with data extracted from the articles involved in the literature review, and we're just putting together the themes that are coming out in terms of values and preferences. And I'm doing this in conjunction with one of the parents from the patient public involvement group. The parent interviews are ongoing. So what are we trying to get from the parent interviews? We're trying to understand how parents make treatment decisions and whether that treatment decision changes over time with the more treatment decisions that parents make. And the inclusion criteria is parents of children who are receiving treatment for relapse or refractory neuroblastoma accept Veritas because this is protocol driven. So we're trying to understand that multiple treatment decision making when there are multiple treatment options available. They have to have made a recent treatment decision. Their child is under the age of 12 receiving treatment, and that's because there's quite a lot of decision-making research out there already, which includes children who are 12 and over. Parents can be re-interviewed if they make more than one treatment decision during phase one being open, and both parents can participate. And we're really keen to hear the voice of fathers, because this has been underrepresented in all of the literature that has been published and research that has been done to date. So in terms of parent recruitment, there are 12 treatment centres open within the UK. And as I said, last year, we included parents being able to self-refer to the study if their treatment centre wasn't open. And that was during COVID, when a lot of centres were either in the process of being set up or hadn't quite been set up. Apologies, you can now see the cat behind me. So in terms of interviews, we've done 9 interviews with 11 participants. So this is 8 mothers and 3 fathers. And in total, they have made 12 treatment decisions. And the data analysis for this will be starting in November, which is really exciting. And then phase 2 will be the development of the decision aid. As I said, there will be a steering group of parents and healthcare professionals that will be supporting the development of this. And this will be from the integration of the data from the phase 1 parent interviews and also the literature review. And once this draft decision aid is ready, we'll be user testing again with parents and healthcare professionals to check its usability and acceptability, ready to go on and do some further studies with it in real life in clinical practice. So in terms of the timeline, of course, with COVID, things got delayed. The phase 1 parent interviews are probably going to be open until June 2022, but this date is dependent on the amount of parents that are interviewed between now and then. Phase 2 will start obviously over the summer or maybe earlier, depending on when phase 1 closes. And it's estimated that early 2024, the decision aid will be ready. All I'm left to say is thank you very much for listening. I appreciate this is an on-demand session. So if you have any questions or want to know more about the study, there's various social media outlets, also the study website that I mentioned, and you can also contact me direct. Thank you for listening.